With a population of an estimated 40 million, Tanzania, a country that lies on the coast of East Africa, loses 150,000 mothers and newborns each year due to complications related to pregnancy and childbirth. About 99% of such deaths take place in low and middle income countries like Tanzania. Maternal deaths are caused by what has been dubbed as the 3 delays, namely, delay in the home level decision to get the mother to professional care, delay in transportation, and the delay in receiving adequate care when a facility is reached because of a lack of life-saving capabilities. World Lung Foundation and Bloomberg Philanthropies aim to decrease maternal and neonatal mortality in Tanzania through targeted enhancements of emergency obstetric care in rural health centers. Specifically, the program is funding the renovation and construction of key infrastructure, building the capacity of healthcare providers through intensive trainings, and equipping trained staff with the necessary tools to carry out their jobs. This maternal health project is currently underway in 4 regions of Tanzania, namely Coastal Region, Morogoro, Kigoma, and Singida. This health center in Kibiti Coastal Region is one of the beneficiaries of the project.
Before 2010, we were not doing surgeries here or emergency obstetric care, but World Lung Foundation has donated this building of the theater building and the renovated maternity ward. So we started doing cesarean section here and the other complicated deliveries.
Ashura is a 35-year-old who recently delivered a baby at Kibiti with cesarean section. She is appreciative of the improvements at the health center.
There has been development. We can now have C-section operation. We are grateful.
Sophia is a 15-year-old and it was her first pregnancy. She came from another village and was brought to Kibiti Health Center after her mother and grandmother sensed that the pregnancy was unusual.
When I arrived, I had pain. The doctor said the child is not lying properly. So they took me to the theater and operated me.
With Bloomberg Philanthropy funded WLF implemented improvements, the healthcare facility has seen a surge of more than 4 times the number of patients per month in just the last 6 months.
We are happy because our patients are well attended. They come from far because after a renovation, the buildings are good and they have trained staff. Previously, we used it to deliver with kerosene lamp and torch, but now it has improved. We used it to face a lot of problems. The reference hospital was several hundreds of miles away, and because of such delays, patients used to die.
Now we are going one step further, and we are decentralizing life-saving skills so we can handle hugely important complications at the health center level. We have no doctors almost at the health center level in Africa. Therefore, in some countries like Tanzania, delegated surgical skills from doctors who are non-existent at health center levels to assistant medical officers, and they are trained in hands-on training to cope with threatening cases. If we send them away from health center level to hospitals, very often they are lost because of the transport delay, and we can avoid the referrals by handling on the spot of the health center all these difficult cases, and that is the main core of this project.
And these AMOs are available everywhere, from district level to health center level. So if you train them to undertake emergency obstetrical care, you give them the infrastructure and the equipment appropriate for that, then you save a lot of lives that could not have been saved had it not been that these services are right in the community.
The success of health centers like Kibiti show the tools that are possible in the countrywide effort to reduce maternal and infant mortality, while also recognizing the importance of family planning.
If Kibiti is the good example and one of the best examples where we can see an upsurge of well-handled deliveries, an upsurge of well-handled cesarean sections, and we are going to show that, then it's scalable to the country. We can tell the Ministry of Health to copy the Kibiti model for the rest of the country.
You know, immediately after the government, the people from national level has come to supervise to see what is going on in Kibiti. It was the amazing situation. They were not believing that we are going to perform these services, and then they are not sure that we are going to sustain these services. So they are now on the procedure to arrange it, to rebudget for the next financial year, to make sure that what has started at Kibiti should be spread in other places within the Tanzania.
We take this collaboration as a very good example, very unique example, very special example in working with us in saving the lives of our women, but also in what we call copying good modeled systems, good practices that have brought in good results, and we've been able to scale up now to other regions.
This unique model of performing comprehensive emergency obstetric care, including C-sections in rural health centers, is so groundbreaking that Tanzania is on its way to becoming a model for sub-Saharan Africa. Reducing maternal deaths is a key UN Millennium Development Goal. Kibiti is a proven solution that, if replicated, could save hundreds of thousands of lives.